I'm meeting people in my seminars all the time, and in the general consensus is that people have a hard time telling their doctor exactly what they want to tell them at the critical moments. So for example, they've waited like 3 weeks to see their doctor, and then finally they get into the doctor's office, then they're waiting an extra hour, and then they're fidgeting, and then they're starting to get a little bit upset that they're waiting, and finally the doctor, swoops in, and then 5 minutes later they're out the door again. So how do they overcome this obstacle? So generally the people are telling me that they're feeling rushed, they're not sure how to be assertive and confident enough to tell their doctor, "One moment, doctor, I have some health concerns that I've been holding on to that I feel are critical to my health. So can you help me?" From fundamentals is that we're all going to be patients at some time. Medical doctors, nurses, everybody. The reason I wrote this book, Get Diagnosed Fast, it has something to do with a level of frustration that I've seen in my medical practice. When we interact with our medical doctor, nurse, or healthcare practitioner, do we feel rushed at our medical visits? Do we feel satisfied when we're during the interview? Do we feel satisfied with the explanation that we receive? And what about at the end, when we leave the office, do we feel satisfied with just the whole encounter? I've been writing this book basically for the last 10 years at least. Get Diagnosed Fast encompasses not just getting diagnosed, but it's how you relate to your medical doctor. Can you tell your doctor your personal, intimate healthcare matters? What I was encouraging people to do in the book is to look inside themselves and tell people who matter their personal matter. If they could tell their doctor what is troubling them, they could practice. From the book, there's exercises to practice, then they can take this and discuss it with the people who really matter in their life. The feedback I'm getting from the seminars generally is that people wish they had known this earlier. Why didn't someone tell them that they could actually approach their doctor in this manner? And they're thanking me for telling them like what the information that they need at each visit. What I'm trying to do in the book is not to let you be controlled by your medical doctor, but rather you are an equal partner in your healthcare.